Good evening, and thank you for joining us for our session tonight, The Heart-Brain Connection, a special health talk for parents and caregivers of children with congenital heart defects. A couple of housekeeping notes before we begin today's session. In this platform, all attendees are muted. While you won't be able to ask a question audibly, please note the QA feature on your screen. If you have a question that is not addressed during the presentation, please feel free to submit it through the QA feature, and we will address as many as possible before the end of our session today. Also, today's webinar is being recorded and will be posted on our website. As a registrant of today's session, you will receive an email with the link once it's live. Also, in the post-webinar email, you will receive a link to a downloadable certificate of attendance. Please allow 1 week to receive the email. At the end of today's webinar, a survey will automatically pop up on your screen. Your feedback is valuable, so we hope you'll complete this brief anonymous survey so we can improve future webinars. Now it's my pleasure to introduce our presenters for this session. We are fortunate tonight to hear from congenital heart experts who specialize in cardiac neurodevelopment and single ventricle heart conditions. Dr. Sarah Plummer is a pediatric cardiologist in the Congenital Heart Collaborative at UH Rainbow Babies and Children's Hospital. An avid educator for her patients and their parents, Dr. Plummer is also an assistant professor at Case Western Reserve University School of Medicine, where she teaches medical students and fellows. Dr. Plummer is joined tonight by Dr. Julia Smith-Payne, a pediatric neuropsychologist specializing in congenital heart conditions, and Kate Vanderkolk, congenital heart nurse practitioner. In the question and answer segment of tonight's program, we will also welcome Shannon Bilski, Congenital Heart Collaborative Patient Navigator and Coordinator of the CANDY program, which you will learn about today. It's a comprehensive developmental assessment and referral program for children with congenital heart defects. Now, without further ado, I'll turn it over to Dr. Plummer to start our session tonight. Dr. Plummer?
Thanks so much, Tia. Good evening, everyone, and thanks so much for joining us for this hour. I hope it'll be a useful session for everyone. As Tia already mentioned, we'll be presenting today on the heart-brain connection and why we need to pay special attention to the brain and neurodevelopment in kiddos who are born with congenital heart disease. As Tia mentioned, my name is Sarah Plummer, and I've been a pediatric cardiologist here at Rainbow for nearly 7 years now. I am co-director of our single ventricle program, and most relevant to our discussion today, I've been the director of Rainbow's Cardiac Neurodevelopmental Initiative since 2018. I wanted to start this evening with a quick shout out to some of our patients and families. We started a patient and family advisory council for the Rainbow Heart Center back in August of last year. Our group is called Heart to Heart, and it's a group of parents, caregivers, patients, and staff who are working together to improve the care of our patients here at Rainbow. Our parents were very adamant that when we started the group, that they wanted a primary focus to be education for parents, and they specifically asked for this webinar on neurodevelopment. So here it is. So I'll start by getting on my pediatric cardiology soapbox, and I love to do this. Congenital heart disease, the type of heart disease that babies are born with, is very common. It's actually the most common type of birth defect, affecting nearly 1 in 100 live births. That is 30 to 40,000 new babies being born in the US each year with congenital heart disease. And when we think about significant congenital heart disease, 1/4 to 1/3 can be classified as critical congenital heart disease, meaning that surgery or some other type of intervention is needed in the first year of life. And this is scary stuff for new parents. So over the course of the past 20 to 30 years, we've become quite good at getting babies who are born with even the most severe forms of heart disease to survive. But now that this is the case, our new goal is to get them to thrive. And we have started to focus more on quality of life. So with this in mind, what kinds of problems can kiddos with repaired congenital heart disease have later in life? Obviously, they need a cardiologist to keep an eye on their heart and make sure that it continues to be healthy. But research over the years has clearly showed us that people who are born with congenital heart disease, particularly the kind that has to be fixed in the first year of life, can have brain and development issues later in life. I'm not going to bore you with all of the data and research and literature that is out there, but this is one of the first papers that looked into this issue, and it was published in 1982 out of Boston Children's Hospital. And since then, there's been continued research into this important issue, including looking at blood flow to the brain before surgery, brain MRI results before and after surgery, the speed of brain development in babies born with congenital heart disease, developmental milestones before and after heart surgery, and the IQ in school-age kids who had heart surgery as infants. And this is just a sampling of the medical literature. And all of this begs the question, why? Why do kids who are born with congenital heart disease have brain issues later on? And the answer is that there are likely many reasons. It's multifactorial. We know that depending on the type of heart disease, that there can be abnormal blood flow to the brain both before and after birth. There is evidence that I already mentioned of delayed brain development. And this brain is thought to be more fragile, more vulnerable to injury. In addition, there's clearly a risk for more injury over time because of medical needs, including sedation, anesthesia, and going on the heart-lung bypass machine for surgery. One way to think about all of these factors is to break them down into categories, and I really like this figure that's from one of the big guideline papers on this issue, which looks at the factors as psychosocial, occurring preoperatively or before surgery, the issues that occur perioperatively or around the time of surgery, and the patient's current cardiac status. And there has been research into each and every area shown here to try and understand how it contributes to neurodevelopmental outcomes and what we can do about it. And here's just a smattering of the literature around medicine's efforts to address the problem that we know exists. How can we protect the brain better during surgery? How can the care we provide in the ICU be more developmentally focused? How can a stimulating home environment help improve outcomes? How should we screen children for neurodevelopmental issues over time? And ultimately, what can we do to improve outcomes? So what types of problems are we talking about? So this list is long and it may be a bit scary, but this is why we need to be on top of it. The type of problems include developmental issues across all areas, including motor and language development, feeding problems, autism-type disorders, behavioral issues, including anger issues, sleep problems, and issues with social interaction, anxiety, and even PTSD, depression, issues with inattention and hyperactivity, including ADD and ADHD, and learning issues, including memory problems and dyslexia that can affect school performance. Because these are not insignificant problems and we want to be able to do something about them, in 2012, the American Heart Association came out with a scientific statement. It's a guideline on how to evaluate and manage neurodevelopmental outcomes in children with congenital heart disease. This is a massive document and it guides our current practice. So this is a figure from the statement paper, and I think it summarizes the problem that we face. Children with congenital heart disease are at increased risk for developmental disorders and disabilities. This has been proven through decades of research. But these issues are typically mild. Next. This orange bar represents kids with mild impairment, and you can see that in kiddos with mild congenital heart disease, next, this first bar here, issues are actually not that common. Next. But the number of kids affected and the severity of issues does increase with the complexity of congenital heart disease. You can see this with these red bars. Next. But I like to remind many parents that many kids will be without disabilities, and there are normal kiddos in each category as seen by these green bars. Next. Of note, genetic syndromes increase the risk the most, and we worry the most about those kiddos. Next. Oh. As proof that kiddos with congenital heart disease can be normal, these are just two examples of true success stories. Now, I don't want you to think that I think that being a doctor is necessarily the be-all and end-all of normal neurodevelopment, but it does require reading a few books and taking quite a few tests. And these are two individuals with single ventricle heart disease, both who have had the Fontan operation. One, Thomas Glenn, who's a doctor and actually currently a pediatric cardiology fellow out in California, and one who's a medical student, Taylor Houlihan, who is at Thomas Jefferson University and plans to become a pediatric cardiologist. And I share them as evidence that anything is possible for our patients, and it's our job to give them the best chance to succeed. So how do we help our patients? The scientific statement paper that I shared outlines for us which patients are at highest risk, and this is a list of the risk factors. Risk factors include having heart surgery in the first year of life, which, as we talked about, can be as many as 25 to 30% of our patients. It also includes patients who are born with the type of heart disease that makes them blue or cyanotic, even if they don't require heart surgery in the first year of life. And then it includes any patient with congenital heart disease who has at least one of the following risk factors: being born prematurely, having concern for developmental delay as a baby, any genetic abnormality or syndrome, history of needing mechanical support like ECMO or a VAD, needing CPR at any point, any patient who gets a heart transplant, any patient who's hospitalized for more than 2 weeks, any patient with seizures, and any patient who's had abnormal brain imaging or evidence of poor head growth. Patients with these risk factors include a significant proportion of our patients and may even include your child. So what do we do for these high-risk patients? We screen them early and often because we know that if we can find problems early and intervene, that this can improve neurodevelopmental outcomes. This brings me to talk briefly about the Cardiac Neurodevelopmental Outcomes Collaborative, or CNOC, which is a wonderful group that was formed after that big scientific statement was published back in 2012. It's a group of healthcare professionals, not just cardiologists, but also ICU doctors, developmental specialists, and therapists that partner with patients and families from many centers, not just across the country, but across the globe, with the ultimate goal of improving neurodevelopmental outcomes and the quality of life in people with congenital heart disease. One significant part of CNOC is that it is a data registry that allows for neurodevelopmental congenital heart disease research across centers and with large numbers. It's something that we don't often have in our specialty. They also sponsor advocacy, education, and quality improvement work. And maybe most importantly for all of you, they give us the recommendations on which congenital heart disease patients need routine developmental screening, how often we should screen them, and what testing we should use. So that you are aware, Rainbow is a member of CNOC, which means that we contribute data to the registry. And every time that a child has developmental testing as part of our program, the results are entered anonymously into the registry database. And this helps all the future patients to come because it supports more research. And you should know that patients and families are invited to join CNOC as members. This gives you access to webinars, even better than tonight's. And if you want to be an active member, there's the potential for involvement on committees and on projects, because CNOC really wants input from patients and families on everything that they do. If you're interested, you can scan this QR code to get to the form on their website where you can join. And just as proof of what they have to offer, I actually got an email just this morning promoting their 4-part webinar series on development and congenital heart disease. So if you're interested, consider joining CNOC to access the webinars. Also included in this morning's email was CNOC's Spotlight on Science, where they summarize recent articles related to neurodevelopmental outcomes in patients with congenital heart disease. Whether or not you'd be interested in actually reading the medical literature, I want parents to be aware of all that's out there and going on behind the scenes to address this issue. And with that, I'm going to hand it over to Kate Vanderkolk, who's going to tell you about our Rainbow Neurodevelopmental Program.
Thank you, Dr. Plummer. As she said, my name is Kate. I'm a nurse practitioner at Rainbow Children's Hospital. I work in pediatric cardiology and had the honor of joining the CANDY team last year as the clinical lead. So I'm going to tell you a little bit about what we're doing with CNOC and what they recommend for our patients, what we're doing here at Rainbow on a local level. So CANDY is a fancy word. It stands for Cardiac Neurodevelopmental Initiative, and that's what we call our team. So the CANDY program is the local Rainbow program that offers the developmental assessments and referrals for the pediatric cardiology patients that are recommended by CNOC. So Dr. Plummer talked about the national collaborative, the research it's done, and what it recommends for our patients, and we've now taken that to the local level so that we can help to optimize the neurodevelopmental outcomes for our patients here at Rainbow. We have an excellent team. This is just a small group of us here tonight. We actually have more people who work with us. So these are the CANDY team members. Dr. Plummer, you just met. Myself, I'm Kate Vanderkolk, the clinical lead. Shannon, you'll meet at the end of the seminar. She's our nurse navigator. Dr. Scher, she's our developmental behavioral pediatrician. Dr. Smith-Payne, she's going to speak shortly after me. And then we have Emily, who's our child life therapist. So she works both inpatient and outpatient with all of our cardiology patients. And then we have a whole smattering of therapists. So we have speech therapists, occupational therapists, and physical therapists, all who are involved in our CANDY program. I think the first and most important question that many of you have getting into this part of the presentation is who should get a CANDY evaluation? More importantly, because you guys are parents and family members, should my child get a CANDY evaluation? So we recommend a CANDY evaluation for any patient that has congenital heart disease and a high risk factor, as well as any congenital heart disease patient who has any neurodevelopmental concerns. So we're going to go over again the high risk factors that Dr. Plummer went through. So the biggest one up at the top here is open heart surgery in the first year of life. So this is where we find most of our patients. These are the babies who required surgery when they were a baby or until they were a year in order to help develop their hearts in the right way. We also recommend it for any cyanotic or blue heart lesion, those kids who don't have oxygen saturations like other kids do. And then there's another list of factors here. So if you have any other of these factors in conjunction with your congenital heart disease, if you were born early, less than 37 weeks, if there was any developmental delays as a baby, so if anytime a nurse or a doctor told you that your baby wasn't developing as expected, if they've ever been diagnosed with a genetic abnormality, these are things like Down syndrome or DiGeorge. If they have a history of mechanical support, these are things like ECMO and other devices that we can use in the hospital. If they ever needed CPR, if they've ever had a transplant, been in the hospital for more than 2 weeks, had seizures, or any sort of abnormal brain imaging. Most of our cardiac babies undergo some sort of brain imaging, so if anyone ever told you that there was an abnormal finding on those scans, that would also be an indicator to come see us in the CANDY program. How do you get a CANDY evaluation? A CANDY evaluation is a little bit different than most referrals, and it can be arranged in multiple ways. During the hospitalization, we actually get a lot of our patients while they're admitted to the hospital and scheduled for their surgery. Through your pediatrician, you can talk to your pediatrician about needing that. Through your primary cardiologist, all of our Rainbow cardiologists here are familiar with the CANDY program and what we can do for our patients, or through a self-referral, and we'll give you some information on that at the end of the program. This is the CANDY screening schedule. So again, CANDY is just a fancy name for our local program here, and this is the testing schedule that's laid out for us by the CNOC program. Testing is a little bit of a scary word. These aren't scary tests. There's no needles, there's no blood work, and actually they're kind of a test with play. We'll get to hear more about those with Dr. Smith-Payne at the end of the presentation. The first test takes place at 12 months of age. This is called the Bailey test. It happens with a physical therapist here at Rainbow, and it really works on seeing if your child is meeting developmental milestones that they're expected to meet. At 2 years of age, we repeat that test, and the child will meet a developmental behavioral pediatrician, and that's Dr. Scher. We then will send the child to the neuropsychological evaluation with Dr. Smith-Payne at 3 years, and then we really focus on transitions. So we'll evaluate the child again before kindergarten, every 2 to 3 years in school, and then just before the transition to high school, and then before turning 18. And that's just before the transition into adulthood, college, careers, other things like that. I think what's important to note about this is that this is the minimum standard. If your child is doing great, these are the only tests that we'll need to do. If there's ever any concerns or something new develops, we can always repeat these tests, and we might have the follow-up be a little bit more frequent for some of our kids. Another important thing to remember is anytime there's a concern, anytime you notice something new about your child, anytime you're worried that they're not meeting a goal that you think they should be meeting by that age, they can always come and see us in the CANDY program. So the next step, once your child's been evaluated by any of the specialists or had any of the testing done, the results are reviewed with you by the person who tested your child. So that would either be the therapist, the physician, or the neuropsychologist. They talk to you about those results and what they mean. They also share those results with the primary cardiologist and your child's pediatrician. We want to make sure everyone's on the same page and knows what's happening with your child. We can also make referrals. A lot of these referrals include things like neurology, the doctors for the brain, audiology, which screens hearing, and then just going to the dentist is sometimes a recommendation. We can also order therapies after these appointments. Therapists include speech, occupational, and physical therapy. There's also feeding programs. We can schedule the follow-up sooner than the next screening time at any point if it's recommended. Once you had your testing and we filled you in and your physicians in, the next step is for us to continue following your patient through our CANDY patient review. Our CANDY team meets monthly and we review all of the patients followed by our team. First, we talk about the patients who were recently evaluated. This is typically anybody who was seen in the last month, and we talk about their results, what recommendations were made based on our testing, and what referrals need to go in for the patient. Then we talk about upcoming patient evaluations. So we like to give our therapists and our specialty CANDY evaluators an update on what's happening in your child's life. If we can talk to them about what their hospital life has looked like, what surgeries they've had, and what concerns the parents have expressed, it really allows you to show up to the appointment as the parents and not feel like you're explaining things from day one. In addition to the outpatient clinics and the screenings that we do, we also support neurodevelopment for your child in the hospital. We've recently started doing CANDY team rounds, which are neurodevelopmental rounds. We do those in the hospital twice a month for any child admitted to the cardiac units, either the ICU or the step-down. We focus on promoting normal sleep and wake cycles, pain control, therapeutic play. We make sure that all the appropriate therapies are ordered. We make sure that we focus on when we can move your child and let them get back to the things that they were doing before they were in the hospital. This includes getting devices out like chest tubes and lines and IVs so they can move around. And again, with pain control so they feel comfortable doing what they should be doing. We also work to identify patients for our CANDY program. So in summary, as Dr. Plummer shared with us, congenital heart disease is associated with increased risk of developmental delays and other behavioral and learning issues. CNOC is the multinational collaborative that works to improve patient outcomes and quality of life, not just survival, but quality of life. Our CANDY program here at Rainbow focuses on in-hospital care of our patients and helping kids meet their developmental milestones here as well as at home, and then frequent screenings so that we can quickly identify any needs your child has and make the appropriate referrals. I'm now pleased to pass along the slide deck here to Dr. Smith-Payne, who's going to talk to you a little bit about the testing process and what you can expect when your child comes to an appointment.
Thanks, Kate. Hi, I'm Dr. Smith-Payne. I'm really excited to be here to talk to you guys. Hopefully my wonderful colleagues have convinced you that regular neurodevelopmental testing is an important part of your child's care, just like seeing their pediatrician or their cardiologist regularly. We really want you to get to know our neurodevelopmental team and help you along this journey to help your kids become happy, healthy adults. So I'm going to be talking a bit about what to expect during these testings and just to hopefully take out some of the mystery of it all. So this is just that slide again, reviewing the CANDY testing schedule. And I'm going to talk through the different parts of this that if you're with us from the beginning, since they're a little baby, what you might expect to see for your kiddos. Next slide, thanks. So that very first one that we talked about, we referred to, it's called the Bailey or Bailey testing. One of our wonderful physical therapists does it for us here at Rainbow Babies. This is designed for our littles 2 months upwards to a few years. And it's just looking for those like core developmental skills that we're tracking for our babies, infants, toddlers. So it breaks into 3 different sections. There's a cognitive scale. This is looking at things like their ability to engage in pretend play, attend to objects, which is sort of baby attention testing, looking for an object that's fallen off a table. It's usually like a spoon, makes a loud noise. There's the language scale, and this is about your baby or toddler's ability to understand language and use it to do things like label objects or people or follow directions like give me the ball or give the toy to mommy. There is also a motor scale to look at those gross motor skills like jumping, climbing, as well as those fine motor skills, so grasping and manipulating objects. And what this test is really wonderful at doing is just helping us identify kids in a structured, standardized way by comparing how they do to other kids their age, and just identifying which of those kids might benefit more from additional support, whether that's through like a Help Me Grow program or some of those resources that Kate mentioned before earlier, like speech or PT, things like that. Next. I put this here just to give you an idea of what the Bailey testing looks like. It's very fun. I always wear pants when I do this one because you're going to end up on the floor with the kids. If you have a toddler, you know how challenging it is to get them to do something specific when you need them to do it. But a lot of this is hidden as play activities, stacking blocks, pictures, doing little puzzles. So I think this is often a hopefully really fun, pleasant experience for your kid, and usually parents are closely involved in this too. We'll probably give you some specific instructions to say or do to help us kind of prompt certain actions or behaviors from your child. So yeah, this is a really fun one to do. All right, next. As they mentioned, then once your child then gets a little bit older, around 2 years old, we'd like to introduce them to one of our developmental behavioral pediatricians. So Dr. Catherine Scher is the one who often works with us. She is great. She's a pediatrician, but has additional training in evaluating and treating developmental and behavioral concerns. So these are the people who just know super well those developmental milestones, what they want to see, when, can give you some insight into, oh, okay, is this normal? Is this not? Should we be asking for more help? And usually that process is done through a thorough clinical interview with them. They'll want to meet your child and interact with them, observe their behaviors, talk with them if they're old enough to do so. Some of our developmental pediatricians supplement then with standardized questionnaires or some tests that are briefer than what we'll do in the neuropsychological evaluation, but maybe some like early academic screenings, things like that. And just like at other points too, they'll use that information to give parents recommendations about further therapies that might be helpful, programs, specialist referrals like Kate was talking about. They're also really good about knowing opportunities for developmental enrichment, whether that's in the community or just things for you to try with your child at home. Thanks. So some of the things that they're going to ask you about and look for is, again, those developmental milestones, where, their language skills, physical skills like fine and gross motor. They're also going to look at social and emotional development. Our developmental pediatricians are experts in things like autism, and so they'll talk to you about what's normal development in that case, and if they have any concerns there. This is a time where we want to assess for, and oftentimes early diagnosis, especially for things like autism, has the best results when we get early supports and interventions for those kids. Any behavioral concerns, and then she'll focus on early academic readiness, things like colors, shapes, numbers, reading to your child, things like that. Once they get to preschool, school age, that's when we move up to the neuropsychological evaluation with me. So I'm a clinical psychologist, but with additional training in assessing neurodevelopment in children, specifically with complex medical conditions like cardiology. And I like to take a full child approach. So I have that psychology background. So I'm going to be looking at their cognitive skills, like attention, memory, language, but also their social development, emotional, and behavioral functioning as well. So similar to our developmental pediatrician, I'll conduct a thorough interview with you. I'll assess their thinking and learning through standardized tests. And so, like I said, the real value, I think, in doing these standardized tests is that I just recently became a mom last year too. So I know it's constantly a journey of wondering if your child's on track. Is that normal? Is it not normal? And that's tough to know when you just have your own kid, and especially you have a special, very unique kid who has this medical history and all these other factors. And so what these tests can do is to give us a statistical reference for how much, how are they in the average range or kind of above or below. And we can use that data, that information, to make some decisions about what might be helpful at school or home. And so we'll compare their scores to other children their age, and these are kids that do not have the same medical background as them. We use typically developing kids to kind of give us a reference for what we would expect. But it gives us an idea of where they might benefit from additional supports, or if it's appropriate to make a diagnosis and talk about next steps. And we'll always do that at the end during the feedback session. So some of the things that I'll look at, so we'll look at even broader cognitive skills. If it's the first time I'm meeting you, we'll definitely do a full general intelligence or IQ test. I'll look at their academic skills like reading, writing, math, assess a few different kinds of memory, both like verbal memory, visual memory, attention and executive functioning skills. Executive functioning skills are those higher order, like organization, planning, mental flexibility, things like that. Fine motor skills. I'll want to learn about their daily living skills or adaptive functioning. So like how well they're able to engage in self-care or shower or get food for themselves, things like that. Social and emotional development. So, always screen for things like anxiety or depression or autism as well. Discuss any behavioral concerns they may be experiencing at home or school. And I do include a brief family functioning screener as well, just to check in to see how the family's doing, if there's any stressors that you guys could use additional supports in, because family health is really important for your child's health too. Next. Those appointments are sort of broken down into 3 parts. There's an intake session where we do that thorough clinical interview that takes typically around an hour, and that's just with the parent. Then the testing appointment, I call it, that's the long one. So I usually talk with my families about plan to be here for the morning or the afternoon. We'll start, probably around 8 or after lunchtime. And it's usually around 4 hours, but we do get a lot of work done, and we only do these types of evaluations once every couple of years, like they'd mentioned. And we take lots of breaks as needed. And usually kids handle this really well, even kids who have a lot of behavioral or emotional concerns. I have had a lot of parents already mention, their kids usually struggle or have anxiety or have trouble at school, things like that. And they usually do handle this kind of appointment really well. We have a lot of experience working with kids with challenging behaviors or who are nervous, and helping them feel really comfortable and good about the testing situation. And then last part is that feedback. Like I said, we do have virtual options for the intake or the feedback, just so you know if that's more convenient for you, or we can do it in person or same day while your child is doing their testing. A lot of parents are curious about what their child will be doing. And so I usually call it sort of like brain games. So a lot of it is honestly talking, but even if your child's nonverbal, there's other things we can do. There's pointing at pictures. They'll do some pen and paper type tasks, especially for like academics. That part will feel a little bit about like school, but a lot of this is different. It's solving puzzles, working with blocks, drawing, asking them to remember stories or pictures for those memory tasks. And like Kate mentioned, it's nothing scary like needles or scans. I don't do well around blood either, so I will be equally traumatized. So mostly we just talk about kids trying their best on this stuff, and we're just here to learn about how they learn. Thanks. And for parents, what we do, the answer is paperwork. So I'll keep you busy while your child's working too. But I do think that you'll get done before them. So there will be opportunities also for quiet time, grabbing a coffee, bringing that book you've been meaning to read. But the questionnaires are really helpful too for comparing your scores to other kids their age to assess for things like autism or issues with anxiety, depression, things like that. So I really value your hard work on our paperwork as well. Next. And so during that feedback appointment, like I said, which can be often is virtual for you all, we'll talk about, I'd like to emphasize this, and Dr. Plummer mentioned this too, while we are assessing and looking for any areas of weakness or vulnerability where we could better support your child, I also want to talk to you about their strengths and what's going well for them. And sometimes the feedbacks are just talking a lot about how great your kid is doing. And so it's just monitoring that over time and making sure they're on a good track. Or like I said, if there's any areas we can support them better, we'll make recommendations around that. As a clinical psychologist, I can assess and diagnose things like ADHD, learning disorders, like dyslexia or dyscalculia, that's math difficulties, autism, mental health problems like anxiety, depression, PTSD, or if there's more global developmental delays, we can diagnose intellectual disability and make sure your child's receiving appropriate supports for that. And I always talk with families about medical and mental health recommendations, recommendations for school, which is a big part. I talk a lot about IEPs and 504 plans and what's appropriate and best setting for your kid. We spend a lot of time here, and so happy to talk through that if you have concerns about what's going on at school. And then also provide some ideas for you to work on at home too, or any other of those therapies or referrals like Kate had mentioned. Okay. So here on this slide, again, how to request one of these evaluations if you're interested. We encourage you to consider it if you think you meet any of those criteria, even if you're just not sure. You can talk to your primary cardiologist about it and they can enter one for you. You can call the number on the screen, or you can reach out to Shannon or Kate, who you met earlier, through email, and they can help arrange that for you. And this information will be in the slides that you receive later, so you can refer back to this if you're interested. Next. So I think we're going to open the floor to questions.
Yes.
Yeah, go ahead, Tia.
Thanks so much, Dr. Smith-Payne. That was really very informative. And yeah, I would like to invite our participants that if they have a question that has not been addressed yet, to please type it into the QA feature. We have a few in there now, and we also received some pre-event questions. And so I'm going to turn it over to Dr. Plummer. But before I do, I want to introduce Shannon Bilski, who is the coordinator of the CANDY program, who's joining us for this QA session right now. Thanks, Shannon, for coming on board with us.
Thank you for having me.
Okay. So Dr. Plummer, anytime you would like to start with those questions you received.
Sure. We did get several questions emailed when the webinar invite went out, and I just wanted to share a couple of them. I'm going to start with an easy one for all of us. So this question specifically asked, I'm curious if the HEART webinar is something for parents of children with complete repairs. My 2.5-year-old had a complete VSD repair as an infant, and we have had no issues, and she's developmentally on track. I don't suspect anything. I'm just curious if it's something I should be looking out for. If anything, I would say she's developmentally further ahead than average. So, you know, I get this question all the time in my clinic, and I think, you know, somebody who had a ventricular septal defect, just a hole, a hole in the heart that was repaired, is going to fall in that mild complexity. If you think back to that bar graph and the 4 bars. So the chance that that child is going to have an issue is less, but they are still at higher risk than the general population. And I will tell you, I take care of plenty of patients who've had repaired congenital heart disease who are above average. I mean, I have some that I'm amazed by our kiddos every day. But the screening is there so that we don't miss issues that a parent might not pick up, or a pediatrician in a 30-minute well child check once a year might not pick up. So, you know, the screening is still recommended because this patient had surgery in the first year of life, and so they would meet criteria. So, you know, I pitch it the same way Dr. Smith-Payne just kind of advertised it to everyone, is that, you know, we're not just looking for weaknesses, we're also looking for strengths. And quite frankly, if I could get this eval for free on my kiddos, I'd be curious to know where they would fall in these areas. So I would say take advantage of the fact that your child qualifies for these evaluations, and why not take the opportunity to see if there's an issue before it becomes a bigger problem. So this patient would qualify for our Candy services.
So Dr. Plummer, you just hit on something that someone sent in a question. So the evaluation is free. The question was whether it would be covered under insurance. So it might be a good time to cover that one.
Yeah, because these evaluations are indicated based on the guideline recommendations, they are covered. We have not had an issue with having any of our patients get the evaluations. Julia, any comments on that? I see you're shaking your head too.
I was going to say the same thing too. It should be, if you have trouble, please reach out to us. We would want to know. So.
And I see someone else asking if an atrioventricular septal defect or AVSD is considered mild, and I'd say yes, an isolated AVSD that was repaired in infancy. And sometimes canal defects can be actually repaired after the first year of life, but that would be considered a mild defect as well.
And can I add on something to that, Sarah, really quickly,
yes,
or Dr. Plummer, real quickly? Yeah. So I think another important thing too, like I think the individual who shared the question too mentioned that their child is 2 and doing great, and that's wonderful. That's what we want to see. In my field of work, we have a pattern of sort of like growth. Sometimes it's called sort of like a growing into deficits pattern that we want to make sure that we're on top of and aware of too. And this is a part of that research that Dr. Plummer shared earlier. So some kids will do really, really well early on in elementary school. And sometimes problems don't start to peak out until they're older, middle school, high school, even college level. I've done assessments where that's the case, especially for things like attention problems, some of that self-regulation. Once, you know, we're not putting a lot of pressure on our 5-year-olds to, you know, like plan their own schedules and get their bills in on time. And so, and they do well when those expectations are lower, they can meet them, they can compensate. It's just when expectations increase and academics become more rigorous, that's when they can start to have more trouble. And we want to do the same thing, to catch those things early, to talk about it, to make sure they're being well supported before it's a big problem. So that's part of why that schedule is so regular every couple of years. It's just we want to make sure that those issues aren't creeping up on us, even when they're older, when they've had, even though they've done really well earlier on too. And like she mentioned too, a lot of those kids also will be just fine and do great, but just want to be on top of it, like she said.
And that's a great point. Another question came through actually, if my child has normal testing, why do I need to come back in 2 to 3 years to see you again? And so that's a great point, Dr. Smith-Payne, in terms of sometimes certain issues don't manifest themselves until certain times, which is, I think, nice that the CNOC, or I think it's actually not nice, it's why they designed the CNOC recommendations the way they did, is that we see the child before they start kindergarten so we can ensure that they do well when they start. And then it's almost kind of like the 2 to 3 years, it's like almost once during grade school, once during middle school, and once during high school, so that, again, at each phase, new issues could manifest themselves, and we want to be able to pick up on those before they're an issue. So that's a great point. The next question I wanted to get into is someone asked specifically about the link between congenital heart disease and anxiety and depression. I don't know, Dr. Smith-Payne, could you speak to that a little bit?
Yeah, I was reviewing some of the literature before now too. And so what we know about that is that some of these kids tend to be at higher risk. It's the same pattern for these like emotional difficulties as it is for the cognitive ones. So the single ventricle patients, the ones with more serious heart disease, are at higher risk for some of these socio-emotional problems as well. Of those, anxiety tends to be the one that we see more often. And like she mentioned too, there can be medical trauma associated with some of the things they've been through, but also just it's a complicated relationship. There's lots of different factors here. So if like they're affected in any other areas, like their social skills or their learning, we can see anxiety or depression result from some of those challenges. It's usually, like I said, it's complex human beings with lots of things going on. And so we can't really say like, oh yes, this was caused by their congenital heart disease, but we know they're at higher risk, and there may be differences in the brain and the neurotransmitters, things like that, that make them more prone to having these kinds of difficulties. But there's also just a lot of other, like I said, environmental factors. If they're struggling in school or having trouble making friends or really want to do sports, but medically they're being told that they shouldn't, like there's a lot of factors that can play into that. And so that's why we always like to check in on that. I love talking about interventions for families and making sure that their kids are in a good place with that, because just being a teen is a stressful time. So we want to make sure everybody is thriving and being well supported in those areas.
Great, thank you. And this is another question that's partially for Dr. Smith-Payne, but I'll answer the first part and then I'll let you take the rest. So the question is when to medicate for issues like ADD and ADHD, but then also do the medications have any risk for heart patients? So I'll answer the second part and then I'll let you talk about when we decide to medicate. So, you know, ADHD medications, a lot of them are in this class called stimulants, and they are known to increase the baseline heart rate by about 5 to 10 beats per minute. So they can make your heart rate a little bit higher. That is generally well tolerated by almost all patients. It is the rare congenital heart disease patient where I would say that a stimulant is contraindicated, but there are certain cases where it would be. And it's mostly in the patients who've had significant kind of scary abnormal rhythm problems. But luckily, those patients are pretty rare. So, you know, we're often asked to clear a patient for ADHD medication use. And I think probably only once or twice I've said no, because even if they can't be on a stimulant, there are other classes of medications that we can use or that the specialist can use. So we can medicate or use medicines for ADD and ADHD in patients who have repaired congenital heart disease. And Dr. Smith-Payne, do you want to speak to kind of when we would decide medications are needed?
Yeah, the answer is whenever the family is interested or would like to try, you can always trial. And if it doesn't feel like a good fit, it's fine. I often encourage them to maybe try something different or adjust the dosage before making that decision, because it often takes some tweaking to get it right. But if you're really not sure if it's really needed for your child, I usually talk with families about kind of 2 red flags. For me, that's if there's oh geez, my lights went off in my office. Hold on. They're motion activated. Sorry. Sorry, 2 red flags. So the first one is if there's any kind of safety concern. So some kids are so impulsive, like we actually have trouble with them, you know, classic, like running into the street or running away from the parent. Or I meet a lot of kids who have had head injuries because they have ADHD type impulsivity and are jumping off of stuff. So if it's a safety concern, we maybe want to think about medicating sooner rather than later. The other one is if it really is affecting their academics, because I think it is a really tough cycle to break out of once kids get really discouraged around school. If they're really struggling, the grades are really low, they start to internalize of like, I'm dumb, I'm stupid, or I can't do this. And I don't want them to feel that way, because then it becomes a bigger problem to work back out of at that point. I want them to have the tools available to them to know that they're bright, and to give them that support if needed. And it is an important tool in a toolbox. And the research is pretty clear that kids with attention problems, diagnosed ADHD, who are on a good medication fit, just do better across most every outcome that we assess: academics, social, vocational. It can be a really helpful tool. So if you're interested, I do encourage families in trying it.
That's great. Another question that I'll just take really quickly. So this question is, our son was part of a single ventricle brain study at Children's Hospital of LA before and after he was born. Unfortunately, he had necrosis in his first post-birth MRI versus the fetal MRI. Not sure if this is always the case. So as one of the studies I actually showed in kind of the background research was a study that looked at brain MRIs before and after heart surgery. And so there are actually a lot of centers who routinely scan all of their neonates, newborns who need heart surgery, before and after surgery. And those studies have actually shown that most of the scans, actually up to 80%, have some abnormality. Usually it's a mild abnormality. It's not something super scary or significant, but it's actually pretty rare to have a completely normal scan. And so I would say It's not always the case that it's abnormal, but it's pretty common, and I think it speaks to why these issues can develop over time and why we need to follow these kiddos closely. And so I guess I feel lucky that there's been so much research into this, and we're starting to try and figure out the why and how to make things better. But there are some things like needing the surgery that we can't prevent, but can we make the surgery safer? Can we make the post-operative care safer? And so that's where we try to have impact. Another question for Dr. Smith-Payne. Someone asked about the link between congenital heart disease and executive functioning. And if you can kind of speak to what executive functioning is, when we would typically pick up that as an issue, and if there's a link known.
Yeah. I'm checking our time. I love talking about executive functioning. This was my dissertation and like a lot of my research. I think I really enjoy talking about it because I find them fascinating. So yeah, executive functions, these are, like I mentioned earlier, it's like your highest order level of thinking skills is where it all comes together. And so it's a lot to do with regulation. It's your attention regulation, cognitive thinking regulation, your emotional regulation, as well as your behavioral regulation. It's all those pieces in it. We look at things like working memory, flexibility, planning, organization, self-monitoring. So these are like really challenging tasks. And so, and because of that, this is often across disorders. This is not just the congenital heart defect population. This is true for epilepsy, traumatic brain injury, most any kind of disorder that affects brain development that you can think of. Attention, executive functioning is usually the one where we see the most consistent problems and the most persistent problems. So we see them early on and they tend to linger into adulthood, or they can have that, like I mentioned, that growing into deficits kind of a thing where early on, not seeing as many concerns, but as they get older. And it just has to do because they're such complex skills. It's involving your whole brain network. We often talk about the frontal lobes as being where those things kind of live, but we know that there's these really complicated feedback loops that are involving all parts of the brain, including like your cerebellum all the way in the back, which we used to think was just motor skills. And if at any point in the development from when they're baby on, because they're so long developing, so this is when they say like your brain's still developing, they're often talking about these like executive functioning skills. That's the piece that's developing well into your 20s, we believe. So if at any point it gets off track, if you think of it like a train, if it gets derailed at any point, you need to build those higher order skills on top of these lower level ones. And so we see these difficulties arise in kids who have, trouble with oxygen flow to the brain or a bleed, or it can just be lots of factors that affect it. So it tends to be the persistent problem. And so we especially look out for that, assess that. It usually pops up more so in school or day-to-day life than sometimes in the testing that I do, but I try to talk extensively with families about those kinds of concerns and monitor closely what's going on. Hopefully that answered it.
No, perfect. That was great.
Yeah,
okay. I was going to say, some of the literature is really showing, this is true for everything, that the more severe the congenital heart disease is, the more likely there are going to be issues with executive functioning. So, more so in a single ventricle patient than in a patient with a VSD. But that's, again, why it's so important to follow all of these kiddos. Mm-hmm. I have a specific question here for Dr. Smith-Payne. So I'm curious on your thoughts about enrolling our daughter in the CANDY program. She's 11 years old and had already been through a very similar program at Mott. She hasn't seen anyone in a couple of years. Is it worth switching this late in her age? And she also has 8 of the 11 high-risk factors that we listed and some delays. So I'm just going to give you my one word, yes, but because I think, like we said, let's see where she is now. Things might have changed since you haven't seen someone in a couple of years. But Dr. Smith-Payne, what are your thoughts?
Yeah, I was actually I was Googling on my phone. I wasn't as familiar with Mott. And so if this is what I think it is, it sounds like it's potentially some computerized testing.
No. Mott is Michigan, University of Michigan.
Oh, is it Michigan? Thank you. Okay.
I actually used to have one of their neurodevelopmental program flyers here because I met the people that run their program. They also have a very robust, very nice program. So
I'm from Cincinnati. Okay. So.
Yeah.
All right. Okay. Well, in that case, I think it would be great to see them. Yeah. And there's no problem. I'm happy to look at previous reports, evaluations that they've done to look at what they did. If you're more comfortable staying with the same provider, if that's someone that's seen your child repeatedly over the years, I think that's fine too. But I think it's nice to have that here with if they're here for their cardiology care. We work all closely together. Like I said, we talk about it with the other team members. If we can kind of help this be a home base for you as well, if that's easier, we would of course want to see your child. And I don't think it's ever too late. I see kids when they're 21 or 22 and it's their first neuropsychological assessment. So it is fine. We're happy to see them anytime.
Yeah, I would say it's never too late for the first one, or it's never too late to come back. So
yes.
Another kind of similar question. My son has Down syndrome and he's followed by a number of specialists, occupational therapy, speech therapy, physical therapy, Down syndrome clinic, cardiology, an infant feeding clinic, Help Me Grow, which is the county resource program. With that being said, would you still recommend considering Candy and Bailey testing? So again, I'm going to go with my gut reaction, which is yes, but at the same time, this child is obviously already plugged into a lot of services and has likely already had a lot of testing done. But call us, ask, let us look over the records and see if there's anything else we can add. The child might, I don't know how old this child is, but might be due for Bailey testing. If that hasn't been done, that can still be helpful. So, I mean, I think this child needs it less than a child who hasn't been seen or evaluated because they already have a lot of services in place, but we may still be able to offer additional evaluation and some services. I don't know, Dr. Smith, anything?
Yeah, I'll add to that. I think the piece that a neuropsychological evaluation could help with is sometimes it's not documented yet. My guess is a lot of children with Down syndrome or kids with global delays meet criteria for what's called an intellectual disability, what used to be called mental retardation. But it can be nice to have that documented in a formal report too, if that isn't a part of one of the services that they've already received. That can just be really important, especially before they turn 18 for transition planning, Social Security, connecting with resources through like the Board of Developmental Disabilities. So if that piece hasn't occurred, I think it'd be really important to make sure they see a neuropsychologist before then. But shout out to you and all of the hard work that you're doing for your child and all of the therapy and services. Yeah, they're absolutely benefiting from your advocacy for them. So way to be on top of it and looking for even more. So we're here too as a resource, hopefully as a part of that team.
Thanks, team. And it's getting close to our end here, so we probably have time for one more question, Dr. Plummer, if you have one there.
Yeah, well, I'm looking for someone who's actually an adult congenital patient, which is wonderful, asked about support groups for older patients. And I think there are a lot of support groups. This person asked if there's, some that are meeting locally. I know with COVID, so many things don't happen in person locally anymore, but we can have the adult congenital team reach out to you because there are a lot of groups both on the pediatric side and the adult side to help people not be alone as they're going through a lot of this. So we'd be happy to connect you. I
don't know if we share that fun fact, which is more adults now are living with congenital heart defects than babies, which is exciting. It means, yeah, it's working and there are peers and people out there too to connect with. So
it's evidence of our success. So yes, it's wonderful. Kate or Shannon, anything else to add before we wrap up? Oh, Kate, I think you're muted.
I was on mute. Our contact information is here on the slides, and we're happy to answer any more questions. And then we're going to reach out to everyone who's typed in a question in the box here that we didn't get to, so you can expect our answers to come to you. And we look forward to getting you guys scheduled.
Yeah, looking forward to hearing from everybody.
Great. Well, in closing, I just want to thank Drs. Plummer and Smith-Payne, Kate and Shannon for your time tonight and sharing this valuable information and answering all these questions. Thank you to our audience as well for your attention. Couple reminders for you. We will send you an email containing the 2 links, one to the recording of today's session and the other to a downloadable certificate of attendance. If you would like more information about the Candy program, visit our website at uhrainbow.org/heartbrain. If you'd like to schedule an appointment or an assessment, you can call the number, excuse me, on the screen, 216-859-5795. Again, just thank you so much for your participation tonight, and have a great evening.
Thanks, everyone.
Thanks.